about all things health. And when we talk about health, how can environment be not related to health? And the reason why I'm talking about environment today is because Delhi, remember, has a dubious distinction of being the most polluted city in the world. And apart from this, Delhi now has this dubious distinction for 4 years in a row. Not just the worst polluted cities in the entire world. It's not just the national capital here.
Yeah, firstly, hi Sneha, thank you for inviting me. And as you said, it's quite strange that we have been speaking and doing this program for so many years and still wondering what to do next. When we were doing our medicine and we used to read forensic medicine, they used to teach us that an ideal poison is odorless, tasteless, difficult to detect. It should be have symptoms which are almost similar to some naturally occurring disease. Probably air pollution fits into everything. No, you don't bother till it's actually hits. And as Professor said, it's normally that's what everybody thinks. When they start seeing the pollution, they start believing it is polluted. So till there is no visual pollution, like nowadays, it doesn't seem polluted. But we don't bother about so we don't bother about the air quality, which is so bad because we have got so used to this. I will tell you that in 2020, when the first lockdown occurred, because of our profession, we had to go out. And we used to drive on the roads and it used to be a different Delhi, seeing skies which are blue. So obviously, this is somehow a cost we are paying for prosperity, for being cities which are probably improving in economy. So that would now gradually percolate down to the tier 2 cities also, because the economy has gone over the years from the major cities to smaller towns, and those things will be same. Look at COVID. It started hitting Delhi, Mumbai, Bangalore first, finally hit everyone, right? True. The second wave went through everyone. So that's going to be the same, because whatever you may do, the cities, they are just smaller cities, but the basic infrastructure, the basic way the cities work is going to be same pan-India. So unfortunately, what is occurring is that the impact now is become a lot. What we are now seeing are not the acute patients, but we are now seeing the impact on the chronic exposure to this pollution, especially in Delhi NCR, where I have been. So when we used to talk around 4 or 5 years back with you, we were discussing more about the impacts of the acute problem, people coming with coughs and dyspneas and all those things in those winter months. Now, what we are seeing on top of it, what happened in COVID was there is now enough data to show that people who have been exposed to air pollution when they had COVID, they had higher chances of getting exposure and they had higher chances of having severe disease and mortality if their lungs were weak because of the effect of pollution or smoking. So what in last 6 months to 8 months we are seeing are almost a double whammy. People who have been exposed for years in Delhi NCR with air pollution, they had 1 or 2 episodes of COVID over last 3 years. And now they are coming with lung functions which are much lower to the it should have been if it was just effect of the
so COVID-19 essentially has worsened the situation.
Yes,
Professor Tripathi, isn't that a very lot of an approach, a more nuanced approach is required? Professor Gopal is what Dr. Gopal is what Professor Tripathi is saying. Dr. Gopal, your closing comments. Do you agree with what Professor Tripathi says?
I think obviously all stakeholders agree to one point that there is a lot of issues now. See this, I'll just like to probably elaborate why WHO came with this 5 micron, this thing. See, 2006 was the last guideline which took them 15 years. And from there, it was 10 to 5, it has come, right? Now the problem is, even in that report in September 21, they were very clear that nobody is going to meet these expectations immediately. So they have had different proposals, say 35, 25, 15 for different regions. Number one. Number two, the whole idea which they also write in the report is to actually now, probably what you said, take this air pollution on war footing, because I think it is now high time, because there were a lot of anecdotal evidences. Now there have been a lot of studies published in a couple of years in Lancet and many reports from AIMS which show that poor air quality days have almost a similar increase in death rates. Number one, COVID almost took away a lot of time for this research, which was probably this 2019 when the committee was formed for clean air. Probably it would have done a lot of work if this it was not because of so
Okay.
many lockdowns and change in the activities. So I would say that let's not go by the figures. Let's not go by what we are targeting. We are far beyond. I think in the graph, if you see which they if you have happened to see the report, the worst maroon color is 50 plus, right?
Yes.
So we are already our annual index which they have reported for India is 58.
Okay.
So we are anyway into the worst one, right? So what all stakeholders, which what I have been probably saying for last 5 years is that it is not a question, it's a socio-political, maybe environmental, everybody to come increase. It is, as he said, our role as doctors is to probably tell our patients there how they can they have been affected, and maybe when they come to us how they can reduce their footprint, maybe the air pollution footprint, like we have carbon footprint, maybe if they can you walk down, if they don't need to take a car to come say a kilometer away, if they can walk down. So a lot of things we can do.
Awareness at a general level, which even the government can in fact
So I
initiate.
think
I mean,
everybody
at the
has a
end of the
role.
day, the government for 2 years, Professor Tripathi, has been harping on hand hygiene, on wearing the mask. To be honest, right now I'm not too sure. I'm actually dreading the winter months, which are just about 6 to 7 months away, and I think the problem is going to recur. I'm a little bit negative when it comes to what really is going to hold for us as the future is concerned, and whether we will be able to deal with peak in pollution levels or not, I'm not too sure about that. However, thank you so much for joining us, Professor Sachi Tripathi and also Dr. Bharat Gopal. Thank you so much for your time and your perspective.